Imagine waking up one morning and suddenly feeling that your hand or foot has gone completely numb. You may think you simply slept in the wrong position, but what if your body is actually trying to warn you about something more serious? In some situations, sudden numbness should never be ignored. Hello everyone, I'm Dr. Ethan, and welcome to Health Pulse. Sudden numbness or tingling in your hands and feet is something many people experience. You might feel pins and needles, burning, weakness, or a strange loss of sensation. Sometimes the explanation is simple. Sitting on your leg for too long, sleeping on your arm, or keeping a joint in an awkward position can temporarily compress a nerve. Once the pressure is removed, normal sensation usually returns. But when numbness happens without an obvious reason, keeps coming back, lasts for a long time, or suddenly affects one side of the body, it deserves more attention. One of the most serious possibilities is a stroke or transient ischemic attack, known as a TIA. A stroke can cause sudden numbness or weakness, particularly on one side of the body. It may also occur with facial drooping, difficulty speaking, confusion, vision changes, severe dizziness, or problems with balance. Another possible cause is nerve compression. Problems involving nerves in your neck, back, wrist, or legs can create numbness, tingling, or weakness. For example, carpal tunnel syndrome commonly causes tingling or numbness in the hand and fingers. There are also medical conditions that can gradually damage nerves. Diabetes is one of the major causes of peripheral neuropathy. Persistently high blood sugar can damage nerves over time, often beginning in the feet. A deficiency of vitamin B12 can also affect nerve function. Some people may experience numbness, tingling, weakness, or balance problems. Certain medications, excessive alcohol use, thyroid problems, and other neurological conditions can also contribute to abnormal sensations. So don't just ask, "Why is my hand numb?" Ask yourself, when did it start? Is it happening repeatedly? Is it affecting one side or both sides? And are there any other symptoms happening at the same time? These details can help identify whether the problem is temporary or something that needs medical evaluation. And remember, if sudden numbness comes with signs of a stroke, seek emergency medical care immediately rather than waiting for it to disappear. If your hands or feet frequently become numb, don't automatically assume that it is simply because of your sleeping position. The pattern of numbness can provide important clues. For example, numbness that gradually develops in both feet and slowly moves upward can sometimes be associated with peripheral neuropathy. Diabetes is one of the most common causes because prolonged high blood sugar can damage the nerves responsible for sensation. You might notice tingling, burning, pins and needles, reduced sensitivity, or even difficulty noticing small injuries to your feet. Another possible cause is vitamin B12 deficiency. B12 helps maintain healthy nerve cells and blood cells. When levels are too low, some people can develop numbness, tingling, weakness, fatigue, or balance problems. Then there is poor circulation. If your feet frequently feel unusually cold and you notice changes in skin color, pain while walking, or wounds that heal slowly, circulation problems may need to be evaluated by a healthcare professional. Nerve compression is another common explanation. If you spend hours typing, using a phone, sleeping with your wrist bent, or putting pressure on certain parts of your body, nerves can become irritated. This can produce temporary numbness or tingling. But here is the warning sign you should remember. If numbness starts suddenly, particularly on one side of your face, arm, or leg, and you also experience weakness, facial drooping, difficulty speaking, confusion, vision problems, severe dizziness, loss of balance, or a sudden severe headache, treat it as an emergency. Do not wait to see if it gets better. Also, if numbness is repeatedly occurring, becoming more frequent, spreading to other areas, or interfering with walking, gripping objects, or daily activities, make an appointment with a healthcare professional. The important message is this: not every episode of numbness means something dangerous, but sudden or unexplained numbness should not simply be ignored. Pay attention to your body. Notice the pattern, duration, and accompanying symptoms, and get appropriate medical advice when needed. I'm Dr. Ethan, and this is Health Pulse. Your body speaks through symptoms. The sooner you listen, the sooner you can take action.